You know, your skull is an absolute fortress. It's one of the strongest structures in your body, built to protect your most vital organ. But what happens when the real danger isn't from the outside, but from within? Today, we're diving into the critical, terrifying chain of events that happens when pressure starts to build inside that sealed box, and the brain has nowhere left to run. So let's just think about this for a second. Your skull is this incredibly tough, rigid container. It can't stretch, it can't expand. So, if something inside, like your brain or blood, starts taking up more space, where's it supposed to go? This is the central life or death problem we're talking about today: increased intracranial pressure. Okay, so before we get to what goes wrong, let's take a quick look at how things are supposed to work, the delicate balance that's happening inside your head right now. The space inside your skull isn't empty at all. It is packed to the brim with three things. You've got your brain tissue, of course, then the blood flowing through it, and finally, this clear liquid called cerebrospinal fluid, or CSF, which is kind of like a built-in shock absorber. Under normal circumstances, these three components are in a perfect, stable balance, with absolutely zero room to spare. And that perfect balance keeps the pressure inside your head incredibly low, somewhere between 0 and 10 millimeters of mercury. Now, to put that in perspective, that's an extremely gentle pressure. It's the safe zone, the sweet spot your brain needs to function properly. But what happens when a gatecrasher shows up? A fourth element, like blood from an injury or a growing tumor, that tries to muscle its way into a space that's already full. Well, that's when you hit the breaking point. Now, your body is smart. It has a couple of ingenious tricks to try and cope, at least at first. When a new mass shows up, the body's first move is to squeeze the blood out of its flexible veins to make a little extra room. After that, it starts pushing that cerebral spinal fluid out of the skull and down into the spinal column. But here's the thing. These are just temporary fixes. Once you run out of veins to squeeze and fluid to move, that pressure inside the skull starts to spike, and it spikes dangerously. And as that pressure climbs, the body starts sending out some pretty desperate alarm signals. We're talking about a headache with a crushing intensity as the brain's delicate structures get stretched. Uncontrollable projectile vomiting, which is triggered by direct pressure on the brainstem. You start seeing vision problems, slurred speech, confusion. These are all massive red flags that the brain is in very, very serious trouble. This brings us to the most critical and life-threatening complication of all. When the pressure just keeps building and the brain has absolutely nowhere left to go, it begins to do the unthinkable. It herniates. This one word describes the brain's physical breaking point. So what is herniation? It's exactly what it sounds like. It's when brain tissue is literally squeezed so hard that it gets forced out of its normal space. Under that extreme pressure, it gets pushed through rigid openings it was never, ever meant to cross, like through the membranes separating the brain's hemispheres, or even worse, down the hole at the base of the skull. And there are several devastating ways this can happen. In a subfalcine herniation, brain tissue gets shoved sideways, which can cut off blood flow. In a transtentorial herniation, the temporal lobe is forced downwards, crushing vital nerves. But the most immediately life-threatening, the absolute worst-case scenario, is tonsillar herniation. This is when the very bottom of the brain gets squeezed out of the skull, directly compressing the brainstem, the master switch that controls your breathing and your heartbeat. When that brainstem compression becomes critical, the body sounds its final, desperate alarm. It's a phenomenon known as Cushing's Triad. And this is where things get really wild, because the body's final response seems totally backwards. First, blood pressure goes through the roof as the body frantically tries to force blood into the dying brain. Then, reacting to that dangerously high pressure, the heart's own safety systems kick in and cause the heart rate to slow down dramatically. And finally, because the breathing center itself is being crushed, breathing becomes erratic and eventually fails. This triad is a terrifying sign of impending brain death. So you've got to be wondering, what on earth could cause such a catastrophic pressure crisis in the first place? Well, while things like tumors or infections can be culprits, one of the most common causes is trauma that leads to a brain bleed. Now, there are two major types to know, and the key difference is basically plumbing. An epidural bleed comes from a torn artery that's a high-pressure line. The bleeding is fast and aggressive, and symptoms can show up in minutes. But a subdural bleed, that comes from a torn vein where the pressure is way lower. This kind of bleed can be slow, kind of sneaky, with symptoms that might not show up for hours or even days. And what's really amazing is that the difference between these two bleeds isn't just about speed. It's something doctors can actually see on a CT scan. The shape of the bleed tells the whole story. It really just comes down to physics. That high-pressure arterial blood in an epidural bleed is so forceful that it can actually peel the brain's tough outer lining away from the skull. That's what creates that tight, lens-shaped bulge. But the low-pressure venous blood from a subdural bleed, it's not strong enough to do that. It just spreads out, following the natural curve of the brain, forming that classic crescent shape. It's a huge diagnostic clue. Now, this entire process of a bleed inside the skull, it's actually one half of a much more familiar story, the story of a stroke. At its core, a stroke is fundamentally an interruption of blood flow that damages the brain. Simple enough, right? But that interruption can happen in two very different ways. The most common kind is an ischemic stroke. That's where a clot blocks a vessel, basically starving a part of the brain of oxygen. But the second type is a hemorrhagic stroke, and that is exactly what we've been talking about this whole time. It's not a blockage, it's a rupture. A blood vessel bursts, and the bleed itself causes the damage through pressure. And while trauma is a big cause, the single biggest risk factor for this happening spontaneously is chronic high blood pressure. And that's where we'll end things. We've seen this terrifying cascade that starts when the pressure inside our head just gets to be too much. But the key takeaway here isn't just the scary medical drama. It's realizing that the most common trigger for this entire sequence, outside of a major accident, is something many of us deal with: chronic high blood pressure. And knowing that, well, it transforms this story from a terrifying possibility into a personal and powerful story of prevention. It's a reminder that the simple choices we make every day are best defense against the pressure building up,